Hello and welcome to the Ask Nurse Linda webinar. You know, this is my favorite day of the whole month when I get to talk to people. So it's always nice to have you here and thank you for attending today. I wanted to take a moment to talk about the foundation and what I do and what is done at the foundation. And that is that we focus on all kinds of paralysis. And so it's just, sometimes people think, oh, it's this, it's that. But we have people who contact us from all different kinds of diagnostic categories that are looking for help in treating their paralysis. So if you have neurogenic bowel and bladder from whatever source, the treatment is still the same because it's a treatment for paralysis. So if you go online and you look at the foundation, you can look up any diagnostic category and find information. And then the specific treatments are the kinds of things that I talk about, the care needs that people have. So if you have a neurological injury or accident, either from disease or from some event that happened, this is a place to be to find out what do I need to do today? How do I need to take care of this issue? And I always think of people who are listening are really very successful people. They're the heroes that are moving along in this program. And the reason for that is because people are thinking, well, I have this question. Nobody knows everything the first day they have paralysis. It's a process, and your body changes and rearranges as all of our bodies do. And so it's an ongoing process. So it's really good when people are calling to find out little handy bits of information that will help them. We also do any age people, so we have information for pediatric patients. We have older people, information for people who are getting older and want information. So it really runs the gamut of any kind of neurological problem with paralysis, and it's for everybody. So welcome. Also, I want to point out that we do have information specialists that you can contact by going to the web page, and you can contact an information specialist if you have a question with an immediate need. Again, it's a great resource for all kinds of things, how to get along in your daily life. There's a great disaster preparedness book that has come out recently, and there's just information about just, what I need to do to take care of my body and how I can navigate the world. Excuse me, I have just a little tiny bit of a cold, so I apologize for that. We also have an advocacy program that's really great too. If you're interested in becoming involved or seeing what's happening, um, and how things are changing and affecting in your life, they're a great place to contact them to see what's going on. So, with that, we have a ton of questions. So we'll go ahead and start with those. Somebody writes in that they've had many bouts of AD over the past 6 months, often more than four a day. And their a cause tended to be faulty respiratory equipment that wasn't working properly. And it's not really a question, it's just something they wanted to alert people to. And I think, it's really good if you are feeling like you have a piece of equipment or something doesn't feel right or something's not quite going right, be sure and contact your healthcare professionals. If, this person was having these troubles and with their breathing, which, is critical to us all. And then, with the response of being AD. So those are really important things. Now, AD, of course, is a critical issue because it affects your cardiovascular system. So it affects your heart. And I wanted to point out we do have wallet cards for medical emergencies. We have this AD wallet card, comes in all languages. This is the adult version that I happen to have. It's a trifold that opens up that tells you all about it. You can write down your regular information, like what your typical blood pressure is. Sometimes your blood pressure gets lower when you have some sort of paralysis. It may go back up as you age with paralysis, but people's blood pressure tends to get lower at first after the injury. So it's important to write you what is your typical blood pressure and that no matter what the source of your problem is, that what your typical blood pressure is because your typical blood pressure runs, say, like 110 over 60, that's considered a very low, safe, in some cases, normal blood pressure. So if it would go up to 130 over 80, that would be a high blood pressure for you. So, but still, somebody's going to look at that and say, oh, 138 over 80, that's still okay, but it's not okay for you. So having this information at your fingertips, all of the information at the Reeve Foundation educational material is free to you. You can copy it off the internet, print it out on your machine at home, or you can send off and you can get these fancy printed uh, information cards. These are they come in a variety of languages as well. So it's just a good thing to have. I say hand them out like candy because if you're in school, you might want your teacher to know. If you go to the emergency room, maybe they've not seen a person with the disease process or the accident trauma that you have had going on in your life. So it's important to take to keep these information handy. That's why it's a wallet card. You can put it in your wallet and take it right with you. It also has the scientific research information printed there so that your healthcare provider who's treating you can go to that gold standard of treatment for, in this case, AD. But there's also one for deep vein thrombosis, and there's also one for sepsis. So it's very important to have those pieces of information with you. So I like this fact about this respiratory equipment causing some problems. If you have a piece of equipment, maybe that, a splint or a problem with your wheelchair, you get that from your physical therapist. So maybe you would want to talk to them about it. Maybe it's your occupational therapist. So go right to the source. They are very happy to help you. If you perceive there's a problem and you need to have it checked out. I also wanted to mention for people it doesn't say what kind of respiratory equipment, and that's okay. I just wanted to talk about respiratory equipment. We did a professional webinar with Dr. Raymond Anders, who is at the University Hospital and the Cleveland Medical Center. So you can contact his office if you're on a ventilator, if you have problems with your diaphragm, talk to him. Well, it would be probably somebody from his office, but they're experts in this and what they're doing. And there's a product that's available to everybody right now. This is not a research uh, project. This is a piece of equipment that is available, and it's an implant that helps your breathing. It is a piece of electrical equipment that stimulates your diaphragm to work. So many people have gotten off the ventilator. Some people have reduced their ventilatory time. So if you are having a problem with your diaphragm and you want to undergo a procedure like this, talk to them, see if you're eligible. Go online, see you can go to his page and find out what it's all about and get more information about it. But it is covered by your payer, and you can get it now. Maybe you might live in a part of the country where somebody hasn't put one of those in yet, but that's okay because Dr. Anders will train them on how to do that. It is a piece of equipment that is out there. Usually I'm talking about things that, well, this is coming out and this is going on. We're living in this wonderful time period where we're making all these forward advancements in treating paralysis. And so this is one thing that is out there and ready to go. Now, they probably will track you for a while because they'll continue to keep data on how the product is doing, but it is FDA approved. It's all set to go. It's out there right now. So that's Dr. Raymond Anders at the University Hospital's Cleveland Medical Center. Or you can go on to YouTube and go to the Reeve Foundation, Ask Nurse Linda professional webinars, and you can listen to him talk all about this. He goes into a great deal of detail about it. Does it help every single person that has diaphragmatic problems? Well, you might have other medical problems but they'll help work around it or do whatever needs to be done. So it's a good place. It's something very helpful. But, you have to find out if it's right for you. Might not be the right thing for you, but find out about that if you're interested. Okay, can TENS help me with my pain in my arms and hands? Well, Okay. First of all, the answer to that question is maybe. It depends on what the pain is coming from. So if it's neurological pain, um, it might help. It just depends on what the source of that pain is and what's going on. Neuropathic pain is actual pain from a nerve. The nerve is causing the pain. Something's upset the nerve and it's causing pain. It can come from a medical problem that you that you have developed if you have medical disease, or it can come from an accident. So sometimes neuropathic pain can be treated with TENS device. Sometimes you need a little something more. Neuropathic pain, which is pain from the nerves, is treated usually with nerve pain medication that's been specially devised to treat nerve pain. Now, there's different kinds of pain, and we have a pain booklet. So that will help you figure out what kind of pain you have. So, like if you get a cut on your skin, that's a different kind of pain that's treated differently. If you overuse a muscle, you might take an Advil or an aspirin or whatever you treat Motrin or Tylenol, whatever you treat muscle pain with. Those kinds of treatments for other pain's not gonna help neuropathic pain. That has to be treated by the nerve. So there are stimulators that are stronger than the 10s that might be used. Um, there's also other medications besides the 2 that are developed specifically for neuropathic pain, which is, Neurontin and Lyrica. I'm saying their trade names instead of their generic names, but people will recognize it for that. You can also take medication that was developed for seizures, or there's some medications that were developed for depression. It doesn't mean that you have seizures. It doesn't mean you have depression. But those medications, some of the side effects are that it helps neuropathic pain. So they will give you some of those medications that treat those, but in real small amounts. So it doesn't affect depression or it doesn't affect seizures, but little tiny doses like 5 milligrams instead of 100. And people will find positive effects from those as well. And then there's a lot of things that you can do that are not medication oriented. And if you get our pain book, which again is free and it will be coming up there in the chat, that pain book um, will give you all kinds of tips for things that you can do to help relieve your pain using natural kinds of techniques like um, putting a warm cloth, not a heating pad, but a warm cloth on the area, or some people use biofeedback. So there's all kinds of different things. Distraction. Some people will use distraction. I know from my own experience, my husband, who had an, uh, neurological problems from disease, and he took the neuropathic pain medications, but he also used a lot of distraction to help with his neuropathic pain, so that would help reduce his pain ability. Now, there's some people who say, and I know somebody had written in a question, I'm going to answer it now, about the opioids were not helping with this neuropathic pain. No, they won't. A Tylenol, no, it won't. You have to take if you're taking medication to treat it, it has to be medication that's formulated or has some connection with neuropathic pain. So, opioids treat change, opioids affect the way your perception of pain is in the body. They make you sleepy, they make you tired, but they don't treat the source of the pain. They affect the perception of the pain. So you want to treat the source of things. You don't want you want to use as much as you can to help treat that. If you've ever had a toothache and you have that nerve pain in your tooth, not just like the gum is swollen, but like you have a really severe pain in your tooth. That is neuropathic pain, as a matter of fact. Fortunately, that's the kind of pain where you can go to the dentist and he can fix it right now. So you don't have to take these medications. But if anybody's had a toothache and you think, oh my gosh, this is so horrible, that is what neuropathic pain is. but it can be any nerve in the body. Okay, here's a person that has extreme perspiration below their T6 injury, including their legs where they rest on their Rojo cushion, their clothes are wet, and then, their skin is wet. And some people have this response. It's because of the autonomic nervous system, which is that part of the nervous system that controls things that happen automatically in your body. So, I don't think heartbeat to keep myself going. It just happens automatically. I breathe automatically. Now, breathing is kind of tricky because I also have physical control. I can hold my breath for a short period of time. I can take in a deep breath if I feel like I need it. So, but the autonomic nervous system controls lots of things in the body, how your food passes through your bowel, digestion, how your liver works. The immune system, which became a really big deal when we had COVID, was that people learned how the immune system is controlled by the autonomic nervous system. So it's like really important to the body, but there's no place that you can point to the body and say, here's the spot where it works. It works from the brain, it controls different parts of the body, and then the brain is always in control, but like for if you get a bacteria in your body or you have a virus, your body cells will automatically respond to that while it sends a message to the brain and says we need more help. So the body will start producing more cells to help you overcome that infection of whatever's going on. Sometimes we need an antibiotic to help with that, but a lot is going on in the body all at one time. One of the things is the control of sweat. So you don't think, oh, it's really hot. I need to perspire now. It just happens. If your body gets too warm, that's your brain saying to the autonomic nervous system, we need to cool off the body. So it releases fluid that sits on top of the skin that helps cool us. And that's what it does. But sometimes, if you have neurological issues, sometimes that gets confused. Sometimes it happens with people who have spinal cord injury that will sweat just below in copious amounts. If you've had a brain injury or a stroke, or some other neurological diseases, you might sweat just on one part of the body or just on your arm or whatever parts are affected. But sometimes it gets out of control and there's just too much sweat. There are treatments for this. Now, if it's all the way below the body, like the lower half of the body, or if it's one half of the body, there's medication that you can take that can help control that. There's also treatments like sometimes people will have, well, it's just the palms of my hands or the bottom of my feet. And this happens to people with or without neurological injury. They just, their palms are all sweaty. And then there's this treatment called ionphoresis, where you put your hand in a tray and a little electric current goes through that. Now I know don't mix electricity and water, so don't do this at home. It's in a special device that, so you won't get electrocuted. But you put your hand in that, and that will prevent it if it's in just one small area. So some people will just have like one spot on their side where the sweat is just pouring out. And so they can do different treatments with that. So there's all kinds of things that can be done about that. Now, this is somebody who said specifically say where their legs rest on their Rojo cushions. So Rojo has a cover that comes on it. Some people sit directly on the cushion. Some people have this stretchy cover that goes over it, which allows a little bit of leeway for air to circulate in between the cushion, which is plastic, which is going to be up against your skin. So your skin's not getting the air that our skin needs, so it's not drying out that. And so the body thinks, oh, I need to sweat because I need to produce all this sweat because the air circulation is not good here. So look into the fact if there's a different kind of cushion cover that you need for the Rojo. Now, you don't want to sit on something like a pillowcase or a towel or something like that because it doesn't have the flexibility that takes away from the purpose of the Rojo. So look for the appropriate piece of equipment being the cover that helps on that. So that is going to be an important little piece of equipment. It sounds like, oh, why would I need that? But it's where his skin touches the cushion and the backrest, and you can get a backrest cushion as well that will help with that circulation because uh, seats and um, pressure reducing equipment like cushions and backrests, they're made out of like a vinyl piece of equipment, so there's no airflow. Now, some people will get one of those mesh kind of backrests. It's a step up, but with this kind of sweating, you might be able to get one. Now, it doesn't say if they're having it at night when they're laying in their beds. Some people get it at night when they're laying on their mattress. And again, you need to have that little buffer of it, that cover over the top to let the air. And also, you're turning more at night. You should be turning more. When you're in your chair, people sit there. We hope that you're doing pressure reducing exercises, so moving in your chair. But if you are higher level, you might have to use the chair tilt feature to change your position to get things moving around in there, but your back is still laying on that cover. So sometimes these mesh backs to the chair, or these different covers will help with some of that sweating. And of course, you want your skin to be clean and dry because moisture increases the risk of pressure injury. So all of those are pieces to that puzzle. So here's somebody that has Claudia equina syndrome, which is a place where their spinal cord has been injured in the part of the spinal cord that comes out of the spinal cord. So at the very tail of your spinal cord, the nerves are coming out. They come out at each vertebrae, but at the very end, there's a bunch of nerves that kind of come out. And that's why it's also called the horse's tail because it's like a tail, but it's inside your body and it's not a tail, it's nerves. But they call it the horse's tail, but that makes sense on some level there. And so, anyway, this is the person who says opioids don't work since they suffer from neurogenic bowel and bladder, and opioids will cut off that bowel function right now. So they want to know the best approach to reducing pain, and so they've moved from opioids to CBD oil. That's a huge jump. There are pain medicines that I went through just previously that treat neuropathic pain. Opioids won't do a thing for you. Some people do take CBD oil. That's a personal choice that you may choose to do. Will it help neuropathic pain? Some people say it does. Some people say it doesn't. But check with your healthcare professional before you start taking any sort of medication. And I want to stress this because, if you get a prescription medication that is coming from your healthcare professional, if you go to the same pharmacy, they can look it up on their machine and they have all your medication prescriptions in there and they can tell if it has an interaction with something else you're taking. Your healthcare professional that prescribes the medication has the same on their machine. So this is one of the wonderful things about computer technology is they type in a prescription and automatically a flag comes up and says, oh, wait, this interacts with this other medication that you're taking. So you want to tell your pharmacist and you want to tell your healthcare professional every single thing that you are taking into your body. That includes prescription medications, it includes over-the-counter medications, anything that you're buying, street drugs. Be sure and tell there's no judgment, but you need to let them know because you don't want one thing to be interacting with something else, creating a third problem, or maybe making the medication that you're taking be not effective, or giving some kind of reaction that is making that medication work more than what it should be doing. So always tell everybody everything that you're putting into your body or on your body. or if you're inhaling something, smoke, or even well, I got some ear drops or some eye drops, and should I tell them about these eye drops? Yes, because especially eye drops work on the smooth muscle of your eye, but it travels throughout your body just like everything else. Your bladder also has smooth muscles. So there is an effect between people who take eye drops. Sometimes that affects their bladder program in particular. So tell everything that you're on. It's just a common sense, important thing to do. How common is it for a quadriplegic to have a normal bowel routine, think everything's working fine, and get diagnosed with a moderate amount of stool in the colon, which is causing autonomic dysreflexia? So, stool in the colon is the number two. Oh, I didn't mean that as a pun. It's the number two cause of autonomic dysreflexia. The number one cause of autonomic dysreflexia, or AD as we call it, is something bothersome with the bladder. The catheters kinked, the bladder's overflowing. Something bothering the bladder can be bladder spasm. That's the number one cause. Something with the bladder is the number one cause for AD. The number two cause is um, something wrong with your bowel, overdistended, a bowel impaction, diarrhea, constipation. All these things can be related to bowel causing AD. The number three is skin issues. And then the number four issue, which is the catch all, is anything that's bothering your body below your level of injury or on the side of your injury. Anything that's bothering your body at all. So if you're sitting on a sheet that's wrinkled, you can get AD from that. So you have to be very careful about what's going on. If you put your leg bag on in the morning and it's empty, and you put the straps on so it stays where it's supposed to stay, and then you don't empty it throughout the day and it gets really full. Now all of a sudden those straps are pulling the weight of the leg bag on your leg. You can get AD from that. So there's AD can come from anything obnoxious happening to the body below the level of injury. So you have to be very careful about that. So is it common for having a normal bowel routine, getting positive results, and then still being diagnosed with this excess bowel in the stool? So is it common? Um, I would say it's probably one of the more common of the uncommon things that happen. Usually, when you do your bowel routine and it's your bowels evacuated, then you're usually good. And the average time that people do their bowel routine is every other day. Some people need to do it every day. And so that is an issue that maybe it needs to be done more. Maybe you need to have stool softener to help move the stool along, because after you have neurological injury or disease, you could have your bowel might slow. Most of the time it does slow, but it depends on what's going on. Maybe in disease it hasn't slowed that much, but as your disease progresses, it could slow more. So, the whole time that that stool is in your bowel, if your bowel's moving slowly, but it doesn't matter if it's moving slowly or not. When there's anything you've digested that's in that bowel, water's being taken out of it to be excreted through the urine or for other ways. So that water's being taken out of that stool to get the nutrients that need to hydrate and the food you need to get to all those tiny little cells in your body. So it's going through the blood. So this, if the stool stays in there too long, it can become hard and it can be harder for the bowel to push through. So you might need to take something like that. Now, for a while, everybody was put on fiber. Everybody had to take fiber. But what we're finding is that people who have neurological injury have issues with their bladder as well. And so they can't take in the fluid that's needed to process this. So we don't really recommend that. But this might be an exception where maybe you need more fiber to help move that along. Now, I can't recommend you do that. Don't go out and start taking that. Talk to your healthcare professional first because that might not be the right thing for you. Because we really don't recommend taking fiber. If you eat a diet that has a lot of fiber in it, that's a healthy diet, your bowels are gonna be functioning okay. If you're eating a lot of processed foods or um, things that aren't easy for your bowel to digest, then you're going to have more trouble. So take a look at your diet, try to integrate more fiber, try to up your fluid intake if it's possible with your bladder program. So if you're doing intermittent cath, it might not be possible. But if you're doing, because you have to watch your volume intakes. But if you have a catheter, a suprapubic catheter, um, if you have an ostomy of some sort, so that the urine is freely flowing, try to take in a little more water, but just a little at a time. So don't go out and say, oh, well, I'm going to start drinking 3 liters of water every day. And if you don't drink that much water, but don't just start doing it. Just increase a little bit by an extra sip or two a week because you don't want to overwhelm your heart. We don't know what's going on in your body and we don't want to overwhelm your heart and give you other problems. But if you have a free flowing, maybe you've had a sphincterotomy, and your urine is just flowing out of your body, and it's not storing in your bladder, then slowly increase and see if that little bit of water will help increase that. So it's not a common problem, but it does happen, and you want to keep that bowel safe. It could be that the stool is too hard, or it's just a lot of stool. Maybe you're drinking way too much water so that the stool stays really wet, and then that makes it heavier and outstretches the bladder. So there's a lot of things to think about here. So talk to your healthcare professional. We have a wonderful bladder. Well, we have wonderful bladder and bowel book. So these are all kinds of things that you can look at all the different aspects of that, and that should help get an idea of what to do. Okay, we have a, a person who's asking about a vet at home, and we love our veterans, who has pressure ulcers. And so, how to care for those at home? Well, that's a tricky question because every pressure ulcer is going to have a little bit of a different treatment. And, some require more treatment, some require less treatment. Again, we have a skincare book that will outline the different treatments, but your healthcare professional will look at that pressure injury and they will prescribe the treatment that is right for you. So that's the first thing. The thing to do when somebody is at home is to make sure that they have pressure dispersing equipment on their bed or their wheelchair, wherever it is that they are laying or sitting. That does not include a pillow. Pillows create more pressure because they don't disperse the pressure. If you go, some people will say, "Well, gee, that cushion I got from the medical supply store cost so much. I could go buy a piece of craft foam." The cells in the craft foam are not made the way medical equipment is done. You need to buy the medical equipment to make sure that the pressure is being spread out instead of all focusing on that one bone pushing on the inside of that skin. They work from the inside out. So be sure you have the right equipment. Be sure you're turning and doing pressure releases so that you're not getting pressure injury. And if you have a spot, like this person has some with an S, so there's probably more than one spot, then you need to stay off that area. Sometimes people say, well, I'm just going to lay on my back and stretch out for a little while, and I have this pressure on my coccyx, on my rear end, or I have pressure injury where I sit in my wheelchair and the sitting bones from the pelvis are creating pressure. And so they'll say, well, I just need to lay here. I just need to get up and brush my teeth. Or I just need to get up and go to the bathroom to do my bowel program. No, when you have a pressure injury, No sitting on that. Even if you get up and brush your teeth for 5 minutes, if you stayed off that area for a day or two and then you just get up for 5 minutes, you put the pressure right back on it and it hasn't had time to even begin the healing process. So absolutely stay off that area where the pressure injury is. So it might be you might need to talk to a therapist about how you can lay on your stomach so that you don't so you can stay off your rear end, or if you can go side to side and stay off your rear end, or if the injury's on the side, so you can go on the other side and your back. It all depends. Just stay off any kind of spot that has discoloration. Try to get, if you have the stage, what's called the stage one, which is discoloration on lightly pigmented skin. It is usually a pink or a red spot. On darkly colored skin, the spot will be more purplish or sometimes kind of a little bit white looking. So that is the start of a pressure injury. Stay off of it because once you have one, healing them is much more difficult. And then once they're open in the stage two, three, four, or five, some are unstageable because they have a crust over the top, but just stay off of them or the best, that's the best thing. Now there's all kinds of treatments. So sometimes if the area is open, they will put a dressing on there, maybe some kind of medication on that wound. And so that's just if the skin's just open, that's usually the treatment. It's when you get to stage three and they're a little deeper and you're into the fatty tissue, sometimes there'll be exudate in there, some kind of like white looking substance in there, some black looking stuff in there called eschar. Do not touch it. Let the specialist say what to do with that. Sometimes it needs to be removed. It should only be removed by the specialist. It should not be removed at home. Sometimes there's medication you can put on that to help dissolve it. That may or may not be the right thing for you because sometimes you want that eschar to be there because it's performing the role of the skin and that it's not letting bacteria in. So if you remove the eschar, you can be doing more harm, or if you remove something that you think is eschar that is not. So I have seen people, um, this one really horrible case from years ago where a man had an attendant and the attendant was in the military and he had some medical training. But people don't really have medical training in pressure injuries. We all know about them. We're all educated about them. We all have an idea, but you really need a specialist when you go because the gentleman removed his said, "Oh, I removed the eschar. There was some white and it was really hard." Well, it wasn't eschar, it was his bone. And so that, it was like, oh, it was such a mess. So let the healthcare professionals take care of that. It might come to a point where you might need something called a wound vac, which is placed in seals over the area. So the area becomes sealed, but there's like a little vacuum that is constantly pulling out the eschar and the waste material that if it's draining, it's just the right amount of suction. They do really well with those. Sometimes it's hard to have those because the machine's been kind of noisy and sometimes people don't like that noise, but if it's helpful, maybe that's a thing to do. It doesn't require a change every day. It's you can have the wound vac dressing might go like for 3 days before you need to change it. So it is some less work, but it's doing a lot of things. So there's ways to do that. And ultimately, these wounds will if they're not cared for or not responding to treatment, they might require surgery. Surgery takes like 6 to 9 months of being off that area to heal. If you get on it too soon, it just splits right open again, and then you've got to have a bigger surgery, and it just goes on and on. So get it under control as quickly as you can, and talk to a specialist on how that should be treated. How can I control chronic UTIs? How can I get a copy of the bladder pamphlet, which will appear right there in the chat box? All the information that's from the Reeve Foundation is available online. and it's all free. So, we just want to help people by educating people of what their options are. And then you take your options to your healthcare professional to find out what is the right treatment for you. So, how can I control chronic UTIs? This is an issue. There's a lot of things going on in the world of bladder management right now. There's a lot of new devices, there's a lot of new things that are coming out. Um, so, there is some evidence that uh, UTIs are no different if you're doing intermittent catheterization versus catheters. So that is one thing that's new that's coming out. There's a lot of studies that's going on. Dr. Suzanne Groh from the National Rehab Hospital has done a lot of work in this. And, it's really hard to get people to understand that it's kind of similar infection rates. So, that's just something to think about there. So she was on the professional webinar too. So you can go on YouTube, Nurse Linda professional webinar, Suzanne Grow, and then you can hear all about her wonderful work. It's really fabulous. I highly recommend it. I could talk about urine all day, and so could she. So it was really a wonderful experience for me. But anyway, I think it was helpful for other people too. So in the bladder pamphlet, there's a lot of things to do. You want to watch your intake, not only how much you're drinking, and I don't know how your bladder management is. So again, like I told the other person, um, if you can increase it just by a little bit, if you're on intermittent catheterization, you might not be able to do that. But that's one thing. But not only to watch how much you're drinking, but what you're drinking. So I think people know nothing with sugar in it. So sodas that have sugar in it, sports drinks have a lot of sugar in it. Alcohol has a lot of sugar in it. But what a lot of people don't know is if you take artificially sweetened drinks, the artificial sweetener works in the same way as sugar, and bacteria loves those. So if you have some bacteria in your bladder and you're feeding it through sugary or through sugar substitute drinks, you're just helping perpetuate that. Also, think about what you're eating as well. If you're eating a lot of foods with sugar, again, that's going through the bowel. And think about that stool going through your bowel that's always being extracted with the water, the fluid from the what you've eaten is being extracted out, and that's going into your cells. Your cells are, turning over just like your skin cells turn over. The bodies in your cells are constantly working. It's different rates, but they're constantly being replaced. And so if they get something in there, they're going to excrete it. It could come out through the blood, which is filtered by the kidneys, which could come out through the urine. So that's the little process for too much sugar in food. That's another thing. So, water is the best. So if you can stick to the water, sometimes people will take things like coffee or tea. A little bit is fine. You want your cup of coffee in the morning, that's fine. I love my iced tea. Oh, I just love it. Again, no sugar, but it does have caffeine in it. Caffeine it also comes in things like chocolate. And so caffeine is another thing that bladders love to. They're just like the bacteria is like, oh, thank you for sending me this gift. You're feeding me more. But so we don't want that. Now, look at if you're doing intermittent catheterization, review that process. Sometimes people make little flubs along the way, so they go over to the sink, they wash their hands very thoroughly, they get their equipment, they wheel over to the toilet to catheterize. Now they've infected their hands, or they've opened the equipment. You want to open your equipment for intermittent catheterization. Just open the package, leave the catheter there, and then wash your hands. If to lubricate the catheter, if you don't have a pre-lubricated catheter and you have that tube of lubricant, and people will want to stick it in. Don't do that because you've infected the lubricant, or don't let the lubricant rim drop the lubricant. Take it above the catheter and let it drop onto the catheter. Squeeze a little bit and let it drop out. So don't let anything touch the opening of that lubricant. Sometimes people use the same tube of lubricant that they're doing their catheterization program. that they're also using with their bowel program, and that can cause cross contamination, even though you're not thinking about it. Oh no, I'm dropping it on, so I did get have two tubes, use one for one, use one for the other. I think that the sticking the catheter in the tube of lubricant, which you never want to do, drop it on. But I think it comes from sometimes in the hospital. I've seen people learn to catheterize where they have the individual packet. So it's sterile in the packet, and they'll stick the catheter in the little packet, and they think that's okay. It's not, because again, that catheter is hitting up against the side of that little tube, that little individual packet of lubricant. It's hitting up against the side of that where it's been ripped open, and it's just causing more infection. So really review your bladder management program. Um, if you're a woman, and I don't know, I am assuming that well, I shouldn't assume anything. It doesn't matter if you're a man or a woman, but as for women, well, and for men too, you clean the urethra with soap and water, and then a lot of people don't clean that off. You need to wipe that off before, or if you have one of the disinfectants wipes that you're using, you need to wipe that off with plain water, because some of those disinfectants, when you catheterize, can go into your bladder, which can cause irritation, which bacteria loves. So, and then when you finish catheterizing, again, you need to clean yourself to make sure you've removed, lubricant around the edges, or if some urine dripped out there, or if there's anything left from cleaning solutions or anything, you want to clean that off. For women and men, you want to start from the top of the urethra and work your way down. Now, some people want to clean the urethra and they'll scrub it back and forth. They're getting it really clean, but that's taking germs from one side of the urethra and introducing them over to the bladder, and then dropping them off. When you scrub back and forth, you're just spreading the bacteria around. So wipe once down, twice down, three times down to get that area clean. Now, men are a little different in that they think, well, the urethra is external, women's urethra is internal. So people can think, well, women have more trouble with infections because, it's in a warm, moist, your urethra's in a warm, moist spot. It's more internal in the body, where men's is dry, the urethra is dry, and so it's a little bit different. But it doesn't matter, because once things get inside that urethra, they just crawl right up there into the bladder. So study how you're doing that, making sure you're not making any errors. Like anything, things become routine, and we kind of leave out steps because we just do. Oh, do I really need to do that? Oh, I don't think so. Oh, I need to move faster. I can do it like this. You have to go through all the steps there. But as I say, wonderful things are coming out in the world of urology. And so there's going to be a lot of changes. But here again, I'm talking about in the future, but I'm talking about in the near future. And there are some things that are out that right now, that can really help you. So these are all things that will be good opportunities in the near future. As I say, we're really going into this really great time of moving forward. I'm going to stop for a minute there and look at the question box. Here, that somebody's a C34 quad. Every now and then they feel like their sugar levels are off. They're not diabetic. Um, something about it's. Oh, my box is a little bit cut off on the side here. Let me move that over. Huh. You explained that before, but I don't remember. Yes. Um, Diabetes is a consequence of neurological disease. It's a secondary complication, because if you're not up really moving those long muscles that's where most of your sugar is processed, or if you're just eating too much sugar in general. But if you're not using those long muscles in your thighs, That's where sugar is processed the most because those muscles are the biggest. So that's where you get the biggest bang for your buck. So if you can do some range of motion exercises, stretching those muscles out, if you can do functional electrical stimulation, if you're fortunate to have a FES bike or that kind of equipment, getting those muscles moving really helps and watching that. So if you want to know if your blood sugars are off, you can get some testing equipment. Now, diabetics use testing equipment where they stick their fingers or they have some other devices that they wear on their skin. Those are going to come through insurance, but you can buy some dipsticks and dip it in your urine to see if you're putting off a lot of sugar. And if you are, then maybe you want to check for type 2 kind of diabetes because maybe your body metabolism is not able to metabolism sugar as it used to. So these are kind of things that if you feel like your blood sugar's off, which is maybe a little dizziness, maybe a little sweating, dry mouth, I really want more fluid. If you're having any of those symptoms, you need to be checked to see if you've maybe developed that type 2 type of diabetes. Does it help to lightly rub around the edges of a pressure sore? And is there a device for that? Actually, the answer to that is no, because when you're rubbing around those areas where the skin is just starting to break down, the capillaries um, are starting to break down and you go around that edge, and you're applying that little bit of rub, you're applying pressure, so you're making it worse. Now, there was a time in healthcare, and it was years ago when people used to say massage, and there's still a hangover with some people who've been around a long time. Oh, we'll massage this and stimulate the circulation. No, you're making it worse. So we don't do that. Um, no, there is no device on the market to do that because you shouldn't be doing it. Okay. Um, Traveling with a challenge of catheterizing. I want to know your opinion on intermittent versus suprapubic advantages and disadvantages. Traveling while doing intermittent catheterization can be a challenge, especially if you're going to be on the plane for a long amount of time because you might not be able to get to the bathroom. And if you get to the bathroom, you can't get in the bathroom. Sometimes people will just lay a blanket over themselves and do what they need to do. And, you just do it kind of privately. If you have somebody with you, sometimes they'll kind of get under the blanket there. And I think you need to alert the staff. You don't maybe need to tell people around you what you're going to do, but at least notify the flight attendants what you're doing so that they don't think something weird's going on here in case somebody see I'm doing something. So those kind of things. Some people will get if they're going to be on a long flight, some people will put an indwelling catheter in just for that amount of time. I did have a question separate for this. Can you use catheters over again? No, you cannot. They need to be sterile. And so the catheters today are a one-time use product. Now, if you're able to, if you have a flight that's a couple of hours so that you can catheterize before you get on the plane, and then you can catheterize when you get off the plane, the bathrooms in the airport are accessible. Sometimes with the really big wheelchairs, that's a hard time with the motorized wheelchairs, but sometimes you can work something out. So sometimes people will do something like that. The advantage between intermittent catheterization and suprapubic catheters, again, it depends on your needs. So some people can intermittent catheterize. Men, it's usually pretty easy because the anatomy is available. For women, sometimes it can be more of a challenge. Some people don't have the hand function that they can do the intermittent catheterization and they need assistance to do it. And so that can be a challenge. But if you can do intermittent catheterization, that has always been the gold standard. Now, again, we're starting to learn that infection rates are not that much different. You'll hear about the infection rates or this or that. It's the way they're counted in the hospital and the payment system. When you really deep dive into it, and there's a Michael Davis, a doctor in Texas, that's done this deep dive and found out that it's really not that much different. So some people, and surprisingly, suprapubic catheters do not have much more infection It's not that much different than an intermittent catheter. So some people like the suprapubic because it's so easy. It is a surgical procedure. There is an opening through your abdomen. Some people prefer the Mitrofanoff, which is a surgical procedure where they take a piece of your appendix or bowel and attach it from the top of your bladder to the back of your belly button, and you just catheterize through your belly button. This was started out in the pediatric group because it's so easy. And but women glommed onto it, and several men, if you have a pendulous abdomen or retracted penis, sometimes it can be hard to reach the right spot. So there's a lot of different things. There's the new device that I talk about it all the time, that tape that goes on your back with the electrodes, and it's a nerve stimulator, stimulating, if it stimulates your lower spine. Some people are having some better luck with bowel and bladder function through that. It's a process to learn how that all takes place, but some people it's working out great for. What kind of disinfectant do you use when wiping down for catheterization? A particular wipe? Well, most people use soap and water. That is what is most recommended because the wipes usually have alcohol in them and that can be drying to the urethra. But if you have to use one because you're out someplace or something's going on, if you use it once, as long as you wipe it off again with water to get that off of you. So is there a particular wipe? There are some wipes that I personally feel are better that are free and gentle. So they have a little bit they still have chemicals in them, but they're not as um, I don't want to say as potent. They work just fine, but they're a little bit kinder on the skin um, around the urethra than like the big wipes, the traditional wipes that you see on TV all the time. Um, so most people will just, wipes are expensive. So most people will just use a little Ziploc bag. They'll put a paper uh, towel or some washcloth with some soap and water in the Ziploc bag and another in a Ziploc bag for rinsing with just water on it. And that's, pretty cheap. Oh, I watched the Christopher Reeve movie. Excellent. That's wonderful too. Um, How do you find a solution to sleep a full night without having to cap? I remember this question from the line. I don't think from the write-ins. I don't think we've gotten up to it yet. So to sleep a full night when you're doing intermittent cath, sometimes you can schedule it so you can get 6 hours sleep. You have to talk to your healthcare professional before you try this. You just have to because I don't know what your bladder function is. Sometimes for some people, if they wait 6 hours, that's going to cause their bladder to overfill and the urine to back up into the kidneys, causing kidney damage. So you want to know how your bladder is functioning, how the sphincters are closing, how it's all working in unison. It's very important to find out. But talk to your doctor if you can wait the 6 hours. Some people will go to bed, maybe lay down in bed so that their feet are higher than their head, and then calf like a half an hour to 45 minutes after they lay down in bed, read a book, watch some TV, have some family interaction or whatever. That brings all that fluid out of your feet, even if in your legs, even if you can't see it, it brings the fluid out and up to your bladder. And so they're catheterized at that time, and then they're able to go a little bit longer. 6 hours is the maximum time in between catheterizations from a medical point of view. So I would stress that. But talk to your healthcare professional to see if you can use some of these other little tricks um, to help with that. What is a good disinfectant for night and day bags? Well, you're supposed to, they're one-time use products. So that's all I can say about that particular thing. Um, let's see if we have any other questions here. Oh, I see we're at the top of the hour. So, um, okay, so let's go with this one. My husband was paralyzed from the waist down in the surgery. He's 80 but strong in torso and arms. he has some leg spasms, but he's working very hard to get a bit stronger. So keep it up. Movement, movement, movement is the best thing that you can do for your body. You have to do all the things, the bowel, the bladder, the skincare, but the more you can move your body, especially the parts that are affected, it provides that stimulation to the nerves from the below the level of injury or the place in the brain. So it shoots those messages up, and if you're thinking about why you're moving, that helps. Um, this other person had an accident. He's having a lot of pain. Again, look into the pain booklet for the neuropathic pain because that's going to be those items that I mentioned earlier is going to be what is going to treat that. Here's a person that's having some trouble finding a place to get treatment. Um, if you live in a smaller area, a rural area, you might have some trouble. Investigate an academic medical center around your in your state. Request through your insurance that if you go there for 2 weeks of training, everybody's insurance, just about everybody's insurance, Medicaid includes 2 weeks of mobility training. So most therapy is done. People say, I need a therapist to do this with me. Most therapy is provided by the people in your home. So get those 2 weeks of training. You can go for a 2 week period, or you can go like one time a month or one time a week for 7 weeks or 14 weeks. It can be a couple of times a week. Get the information of everything that you're doing. Don't just passively sit there and say, "Oh, they're doing my stretches now, so I'll just look on my phone and play." Get involved in everything they're doing because they have ways that you can do it yourself. If your arms move, you can exercise your legs. If you need help, have your caregiver or care provider, somebody who's taking care of you, have them come and help you learn how to do these so you can continue mobility training. Learning to roll in bed is mobility training. Trying out equipment like a standing frame. Most payers will allow a standing frame now. Try out some of the newer equipment, the electrical stimulation equipment. Try out and see because that will help bolster your request to get some of that equipment. So those are the things that really need work. What's the best way for swelling in the ankles and feet? They wear their TED hose. Some people wear TED hose and they also wear ACE wraps or wrapped around there. Be sure you know how to put the ACE wrap on correctly so you're not, it goes from the toes to the heart. So if you do it the other way, you're going to make more. And also, if you put your feet as often as you can higher than your heart. So if you can put your feet up while you're sitting, that's good. That's a start, but your feet won't be up higher than your heart. So you really almost need to get into bed, put your feet up on some pillows so that fluid comes back up. Um, they said I still can't wear my stilettos. I hope that's a joke, and I love it. And I hope that you do get to wear your stilettos if that's what you want. Okay, they're also having a struggle with um, super low blood pressure and autonomic dysreflexia. And so after neurological injury, you can have problems with really low blood pressure. And again, those TED hose will help with that blood pressure, moving slowly from spot to spot, but it's not at all unusual with neurological uh, trauma or disease from some sort from anything for your blood pressure to go down a bit. So you might have to, take a little bit longer for your sitting and standing up. So about that, I've gone over my time, but I really have appreciated being with you, and I thank you for attending today. Oh, and this Sunday, I'll be at the New York Metro Abilities Expo, so come by and say hi. I'd love to meet you. It's one of my best times is when I get to meet people. So thank you for joining with us today.